Hi, I am Dr. Jyotsna, Consultant Obstetrician, Gynaecologist and Laparoscopic Surgeon at the 9M Ankura Hospitals, Gachibowli. All the cells in our body require glucose to function, and this glucose is derived from the food that we eat and partly from the liver. For this glucose to enter our cells, insulin is required. When insulin is deficient, or if the body does not respond to the insulin that is in the blood, a high sugar occurs, and this is what happens in people with diabetes. When this happens in pregnancy, it is called gestational diabetes. Gestational diabetes is usually seen after the 24th week of pregnancy, and since pregnancy is a diabetogenic state, the sugar rises as pregnancy progresses. In some women, we can see high sugars even in early pregnancy, and this could be because of a pre-existing high sugar called overt diabetes. You're more likely to get gestational diabetes if you have had it in your previous pregnancy, if you're overweight, if you are older than 25, especially if you're older than 40, if you're an Asian, or if you have a family history of diabetes. Gestational diabetes can cause the babies to grow faster and heavier with excess amniotic fluid around them. And this can lead to a risk of preterm labor, labor abnormalities, malpresentations, and a higher risk of cesarean, high blood pressure, and the high sugars. The babies born to diabetic mothers can have complications related to low sugars and electrolyte abnormalities. Hence, it's important for a good tight sugar control and planned delivery. All pregnancies are screened for gestational diabetes around 24 to 28 weeks of pregnancy by a oral glucose tolerance test. If the results are abnormal, the first step is to give medical nutrition therapy, which is nothing but a prescribed customized diet plan to keep the sugars under control. If the sugars are not controlled with diet, insulin injections are advised under the supervision of an endocrinologist. Regular home monitoring of the sugars and supervision of endocrinologists to adjust the insulin dosage, and regular antenatal checks with the doctor to check on the well-being of the baby and the growth by ultrasound will help us to decide on the perfect timing to deliver the baby and get the best outcomes for the baby. After delivery, the sugars may normalize in a majority of women within a few days of the delivery, but in some women it may take as long as 6 weeks, and a small percentage of women can have continuing high sugars.